Alright guys, it's Dr. Muhammad. We are going to close out the Public Health Sciences unit by doing a couple practice questions. We're going to go through the questions nice and slow, break down the right answer while all the other answers are incorrect, and hopefully this will help prepare you guys for when you see these questions on test day. So let's go through it. Two patients present to the emergency department for evaluation at the same time. The first patient is a 25-year-old female requesting a refill of her anxiety medication. She states that her primary care physician's office is across town and she thought it would be easier to get her medication refilled here. The second patient is a 67-year-old male grabbing his chest and complaining of difficulty breathing. The physician decides to see the 67-year-old patient first. Which ethical principle is most likely displayed in this scenario? I'll give you guys about 10 seconds. Feel free to pause the video if you need more time, and then we'll go through the right answer. The correct answer in this case is going to be B, justice. Hopefully you got that right, but let's break things down and go through it to make sure we know why. So let's go through the question again, and if we look at the question that's kind of standalone by itself, which ethical principle is most likely being displayed in this scenario, that kind of allows us to hone in on exactly what we're talking about. We know we're talking about public health sciences, we know we're talking about ethics, and more specifically than that even, we know we're talking about ethical principles. So hopefully just by looking at that, you kind of know exactly where we're going to be going with this question. But let's go to the rest of the stem. Two patients present to the emergency department for evaluation at the same time. So clearly by saying that, they're going to make you kind of pick something here. The first patient is a 25-year-old female, so young, sounds like hopefully pretty healthy, requesting a refill of her anxiety medication. So not a serious medical problem, she just wants a refill of her medication. It's a lower stress situation. She states that her primary care physician's office is across town, and she thought it would be easier to get the medication refilled here. So it doesn't sound like it's something of an emergency, it's just kind of something that's more convenient. The second patient is a 67-year-old male, so older, potential to be more sick, grabbing his chest and complaining of difficulty breathing. Now you can see just by looking at the question here, the first patient kind of just walks in requesting a refill. The second patient's coming in, grabbing his chest, and he's complaining of difficulty breathing. So there's very different scenarios going on here. And the physician decides to see the 67-year-old patient first, which hopefully shouldn't be a surprise to you. Now that we've gone through that, it's asking us which ethical principle is most likely displayed in this scenario. So if you remember from one of the early videos in public health sciences, we already talked about the core ethical principles, and there's 4 of them. It was autonomy, beneficence, non-maleficence, and justice. So hopefully right off the bat, just from that, you'll see that answer E here, negligence, isn't technically one of the ethical principles, so we can probably go and scratch that out right now, and we'll come back to it to explain a little bit more about why it's the wrong answer. But let's go through all of the other ones. Choice A, autonomy. Remember, this is respecting patients as individuals and respecting their choices. Not really applicable here, right? It's not talking about the patients making any certain decisions or any disagreements or anything like that. In this case, it's the physician that's making the decision to see the second patient first, so not really applicable, I would say. There's no issue of us respecting or disrespecting a patient's autonomy and their decision to make their own choices. Choice B, we're going to come back to at the end because I want to eliminate all of the other incorrect answers first to make sure you guys understand how we got there. Choice C, non-maleficence. Remember, this ethical principle said do no harm, and in this case the physician isn't doing any harm, right? They're just choosing to see who they think might be the sicker patient. You could maybe make the argument that by not seeing the first patient they could be causing harm, but there's not really direct harm there. That's a bit of a reach. So non-maleficence probably not the appropriate, the most likely ethical principle in this scenario. And choice D here, beneficence. Remember, this is acting in the patient's best interest, and this is doing good. Now this one might get a little bit tricky, and this is kind of how these multiple choice questions go, right? There's some answer choices that you're able to eliminate pretty easily, and then there's a couple that kind of leave you up in the air a little bit. So beneficence, remember, this is to do good. You can make the argument that the physician is doing good by seeing the sicker patient, the 67-year-old with the chest pain and the trouble breathing first. However, going back to the question again, it's asking us which ethical principle is most likely displayed in this scenario. If we take a step back, the physician has 2 patients in the emergency department, and that physician needs to determine which patient is sicker and which patient needs to be seen first. What does that sound like? Hopefully after hearing that, you're thinking that this sounds kind of like triaging, determining who needs to be seen first, determining who we need to take care of sooner rather than later. And if you remember back in those videos from core ethical principles, triaging is actually a really good example of justice. Remember, we want to treat our patients fairly, but this doesn't necessarily mean equally. So triaging is a great example. You want to see the sicker patient first, the patient that's at higher risk of having things happen. And that's why triaging is so important, and triaging, you really want to associate that with justice. I understand that beneficence could potentially be an answer, but in this case, the more appropriate, the most likely ethical principle is justice. In this question, beneficence is not the most appropriate answer. And then going back to E at the end there, negligence, we didn't really talk about it with the public health sciences, but negligence is essentially when a physician fails to do what any other reasonable physician or healthcare provider would do in a situation. And I think by reading this question, you could see this is a pretty reasonable thing to do, right? Any doctor, any healthcare provider would see the older, sicker patient and want to see them first. So this is not an example of negligence. An example of negligence, especially with regards to this 67-year-old patient that's grabbing their chest and is having shortness of breath, would be not getting an EKG or not getting a chest x-ray. These are things that any reasonable physician would do. So if the physician for some reason were to fail to do that or just didn't want to do that, that would be an example of negligence.